So why do stress and anxiety seems to worsen gut symptom during menopause?
This is what we discussed before. We know that chronic stress increases the cortisol levels. Cortisol itself affects the gut by, again, changing the motility, increasing the leaky gut effect. Again, has changes in the microbiome. So all of that does affect the gut. Also, we know that sleep disturbances that can be linked with menopause can exacerbate the sensitivity of the gut, so make the gut even more sensitive nerve-wise, and that these alert states that they happen because of poor sleep, because of changes in our routine, because of the changes in the woman's body at menopause, I think they all affect the gut with all the things that we discussed before. So it is the gut-brain axis that is hyper alerted, as we said, and the effect of cortisol with estrogen decline together has an extra effect.
Yes, yes, definitely. I mean, we always mention about stress repeatedly because stress is not just emotional, it is biological, and it can affect, like you mentioned, all the different part of the guts. And stress is not only for gut, it can also affect our sleep and how we manage our appetite, craving, and inflammation in the body. So I would like to put a message across like stress management is not like a luxury things, it is a necessity that we have to do the simple practice for daily to manage our stress level down as much as we can.
Yeah, and that's why there are quite a lot of now approaches to manage gut symptoms with, as you mentioned, psychological therapies that we can discuss a bit later.
Definitely. Yeah, we'll get on to that. So now we will be discussing about diagnosis and medical insights. So as an expert, how is IBS actually diagnosed and what tests women should expect?
So there's no single test, unfortunately, to diagnose IBS, which makes it a bit more challenging. Although it is a positive diagnosis, there is based on particular criteria called the ROM4 criteria. The main symptoms are abdominal pain, which is normally linked with changes in the bowel habit or the bowel frequency. And that needs to persist for at least a few months and happen at least a few times a week. So this is kind of the criteria that we use. But before that, we need to do some tests. So normally every woman should have some blood tests to rule out any anemia, look at inflammatory markers, look at the thyroid function, gluten intolerance, and maybe some stool tests for simple things like obviously ruling out cancer, inflammation, or some simple basic investigations like an ultrasound or sometimes colonoscopy if red flags are there.
Yes, definitely. So, of course, we have a UK NICE guidelines, and then the main, message that we have is like to review all the symptoms and then think about the appropriate relevant tests to be able to make a diagnosis correct for symptoms like IBS. And, sometimes clinician will order different tests. It doesn't mean that there is always something sinister going on. And it is always important to find the balance of reassuring the woman, like, we are trying to make sure that things are checked properly to rule out any condition that have overlapping symptoms. So what are the biggest misconceptions about IBS?
I think the number one is that it's not a real disease. I guess that we can hear that a lot. It is definitely a recognized condition, and there are evidence-based links with neurological, hormonal, microbiome like changes. So we know that it is a disease caused by physical changes that are happening in the body. I guess number two is that some people believe it's just psychological, it's just in someone's brain. And again, we know that is a bidirectional, as we just discussed, link. So the gut affects the brain and the brain affects the gut. So we can't just think that is just one direction. So we know that the changes are happening in the gut because of hormones or foods that we eat that can affect our brain as well. And I guess the third misconception is that nothing can be done. So we know that there are things that we can do, whether that is related to diet, whether it is related to psychological therapies or medication, that we can help women and anyone involved or affected to feel better.
Yes. So Yeah, one key message is like it's a real medical issue and it is quite common. So you are not alone if you experience with things like IBS. In reality, the IBS is usually multifactorial. Just like we talk about, the food trigger can be quite predominant for some people. Having said that, there are also other elements of stress, sleep imbalance, hormone imbalance, and nervous system dysregulations. And all of these can play a role in terms of IBS symptoms and how they manage. So as a lifestyle physician, I have a lifestyle medicine diploma. That's why lifestyle medicine approaches works really well for IBS, because it is based on the different kind of like a lifestyle pillar, which we talk about it later, but by building a whole body plan to make sure that, your nervous system and gut and brain axis calm down.
Yeah, no, very important to holistically approach every person.
Definitely. So are there other conditions that can mimic IBS that women should rule out?
Yes, of course. I mean, apart from the sinister causes that we discussed earlier from red flags, there are benign conditions that can mimic IBS, as you said, especially with IBS diarrhea predominant. So conditions like, for example, gluten intolerance can be quite common. And it's normally a simple blood test to start the investigations from. Things like SIBO, which is like a small intestine bacterial overgrowth, that is, again, sometimes become more prominent during menopause because of the hormonal changes that we said and the motility changes, so the small bowel doesn't clear quickly, so the imbalance in the bacteria can present with bloating. So that is an alternative diagnosis for people with bloating. Other things we can look at is a bile acid diarrhea, which again is misdiagnosed a lot of the times for IBS. Other forms of colitis, or of course for bloating, gynecological conditions, simple things that you're probably more aware of, but like fibroids or endometriosis or other symptoms that women need to rule out before IBS is diagnosed.
Yes, of course. Proper assessments always matter. Just like you mentioned, yes, in my private GP and menopause clinic, we see a lot more women with a gynecology condition. So endometriosis is one of the conditions that women can generally have gut symptoms and bloating predominantly. Sometimes also with the hormone replacement therapy during menopause, it can also impact on endometriosis sometimes. So yes, we all need to look at the whole picture and then make sure that every symptom need to be properly assessed, especially if they are new, persistent, and worsening. So what does a gut-friendly diet during menopause really look like?
So I guess that's not just for menopause, but in general, we know that the gut microbiome loves diversity. So plant diversity is probably the main very evidence-based approach to support your gut microbiome. So 30 plants per week to help with their diversity. So that's number one. And then we talk about fiber. So high fiber foods, essentially vegetables, fruit, nuts. Then we're looking at omega-3 fatty acids, which are also helpful. We're looking at fermented foods like live yogurts, kimchi, kefir, that will help also with that fermentation, and generally avoiding inflammatory foods like ultra-processed foods, alcohol, sugars. So anything that you can do to have a healthy, balanced diet and what we put in is important. So that is definitely going to affect your mood, your digestion, and your body in general.
Yes, I totally agree. So one key message I want to give as a lifestyle physician and lifestyle specialist GP is we have to start with the food quality and food rhythm and not aim for perfection, because it's very difficult to get the perfect diet every day of our life. So we just have to think about slow and sustainable change and have to think about like a whole food plant-based diet, and the principle of something we call like a eat the rainbow. So if you start with like trying to go to the supermarket, and if you look at your grocery shopping baskets, make sure that you put as many color as you can, like with rainbow color fruits and vegetables. And if you start with these small little steps, and you will be able to build a plate that can nourish not only your hormone, but also your gut and energy level at the same time. So is the Mediterranean diet as powerful as people say for hormone and gut health?
Yeah, the data is quite impressive. It's probably the best or the most studied diet, and it has shown for sure that it does improve in general, not just for gut health, but it definitely improves microbiome diversity, but also it has quite a lot of impact in metabolic and cardiovascular conditions. So I would say for sure for women at that age that also have other conditions with a decline of hormones, it is important to visit the Mediterranean diet and try to adopt it as much as possible, because we do know from the data that it has very positive effects for sure.
Yes, the British Menopause Society, they do highlight that Mediterranean diet is good for menopause care, part of like a very sustainable, easy, realistic, a way of like a, diet that you can incorporate in your daily life. And the reason being is just like you mentioned about cardiometabolic health. One woman approach perimenopause and menopause, the hormone decline can increase the risk of heart disease. And at the same time, the metabolic dysfunction is quite common during that stage. So yes, Mediterranean diet, they are very simple and easy and efficient type of diet that we all can, start incorporating. But the key message here is to have more consistency. So whatever you do with the diet plan, need to be sustainable and consistent.
Yeah, no, it's not always to be everyday perfect, but it's good to know what's right and try and do that
in a consistent way. Definitely, yes. So can you explain the low FODMAP diet and what is it suitable for?
Yeah, so FODMAPs are fermented carbohydrates, and essentially is what is contained in different types of food like wheat, onion, garlic, different fruits and vegetables. So a lot of those foods or vegetables will have what we call FODMAPs, but some foods are low on FODMAPs and some high. So what those fermented carbs do is that they draw more water into the gut and therefore also ferment quickly and cause the symptoms of diarrhea and bloating. So there have been studies that following a low FODMAP diet, especially for a short period of time, let's say a month or so, it is important to reduce those symptoms. But because it is by itself a restricted diet, we do normally say that you follow it strictly for a month and then slowly try to reintroduce foods to try and find your personal triggers. So it's not a restrictive diet forever. It's just about finding these personal triggers and then helping yourself, empower yourself to understand why your symptoms occur and what can you do about it. So it's always better to do it with the help of a dietitian to avoid restriction, because fiber is good in general for a microbiome, as we discussed. So there are some applications online, but dietitian support is most of the times quite beneficial.
Yes. So it's a tool, but not a lifestyle, that you should be doing long term. And it is a short term, and it should be more structural guided approach by the trained dietitians, because we do not want women, unnecessarily restricting foods and lacking in nutrition that they can get from different kind of fiber. So yes, the goal is more like a confidence and clarity. Not to have smaller and smaller food lists on our, diet plan.
Yeah, exactly.
Yeah. So how important it is to be consistent in lifestyle habit for improving gut health?
I think the gut likes a habit, likes to be predictable. So it's good, as you said before, to try and have regular meals, try to prioritize our sleep and exercise. So have these kind of healthy habits in our daily practice that will make the gut be a bit more nobody has to deal with and be a bit more kind of easy to function. So exercise, they say exercise 30 minutes per day or 5 times a week improves for sure the gut motility, and it's encouraged for women. Yeah, I think it's important to try and do that.
Yes, yes. So definitely your body responds, beautifully to rhythm and consistency, right? Especially during the hormone transition that we are talking about, perimenopause and menopause. It is important to have a slow, steady change so that we can have more like a sustainable long-term success. So just like you mentioned, 30 minutes a day is easy to do and is manageable. And even if you don't have 30 minutes all in one go, it's more about doing like at least 10 minutes each time for 3 times a day, which is very easy to do within the daytime of your routine.